Hello and welcome to Nature Source Care. My name is Dr. Funda Goldman. In today's talk, I was going to discuss homeopathy for trauma, shock, and shutdown. And this is specifically about the Bach Flower Remedy, the Star of Bethlehem. So let's go. A note first, the information presented here is for educational purposes only. It should not be considered medical advice. For any symptoms that persist or worsen, please consult with a qualified medical professional. It's always best to determine the root cause of any disease and to develop a comprehensive treatment plan. And while homeopathy or Bach flower remedies can be very effective, they may not be appropriate for everyone or as a single therapy. So please keep that. So the Star of Bethlehem Bach Flower Remedy, just a little bit of background first. Bach Flower Remedies, if you're not familiar with them, are a kind of homeopathy, which is an energy medicine paradigm. And you can get more history and background on Bach Flower Remedies in my first Bach Flower Remedy video on the Walnut Remedy. But the general concept of Bach Flower Remedies is that disease stems from an inner struggle. And what I found in my practice is that these remedies can be very effective for especially mental, emotional, spiritual conditions, things that are um, more intangible, a little bit difficult, more difficult, I think, to access sometimes with people. And if you like this kind of content and want to see more, I have other videos like this in my Bach Flowers playlist and my homeopathy playlist, so you can check out more there. But the keynote, the main kind of or important symptom that you'll notice about somebody in a Star of Bethlehem state is that they will have experienced something traumatic and that they're now in sort of shock and shutdown mode and they never fully recover from that. So the inner state of being that's problematic here is that they're stuck in the healing process and they don't transition through it completely or appropriately. And so there's this almost sort of disconnection with self because the trauma sort of jolted them in a way where it jolted even their recovery mechanisms. And the thing about Star of Bethlehem to know is that it's actually one of the ingredients of the product rescue remedy, which if people have done any Bach flower remedies, they usually find that one first. And there are 5 Bach flower remedies in rescue remedy, and Star of Bethlehem is one of them. And so you can probably see already why. Well, let's get into more of the symptoms of Star of Bethlehem, so it's a little bit easier to identify when you come across it in yourself or others. So again, this is after it's a trauma response. So there must have been some sort of trauma, physical, mental, emotional, spiritual. The other thing to know is that it doesn't have to be, everybody's idea of a trauma may be different because some people are more sensitive. So what may be traumatic to you may not be traumatic to somebody else. So you have to have some flexibility there in terms of identifying what's trauma for somebody else. Yeah. And this trauma can be acute or chronic, and it can be recent or in the long past. So sometimes people have a trauma from long, long time ago. They may not even remember. And that's what's causing the Star of Bethlehem presentation. So the thing is that in this state, people are really unable to cope um, and overcome. So again, they're just stuck instead of the body, the mind, the heart, spirit processing the trauma and fully digesting it and moving through it and moving on, they become stuck. And again, this process, people who are more sensitive are maybe more likely to get stuck in this process because they're just completely overwhelmed and their nervous system is overstimulated. This can also result, the Star of Bethlehem state can also result in psychosomatic problems. So whatever that might be. There's a whole myriad of symptoms that can be psychosomatic, but that's a possibility. And generally, people in the state will seem more kind of subdued, maybe lethargic, maybe lackluster, and just generally held back, where they seem like they're not fully engaged, especially when you compare them to pre trauma, how they were. The other thing about people in the state, they have a tendency to check out. So they might engage in things like drug use or yoga or other alternative subcultures and things like that. Because again, they're kind of when they're not feeling quite themselves the way they used to, if they don't feel completely grounded in their body, if they don't feel completely confident, because again, that trauma, that sort of energy knot has not been, unwoven and moved through, then they might start seeking out alternative spaces almost as a way of um, sort of externally trying to soothe themselves. Again, with drugs, for a lot of people, that's a way of checking out because again, they they can't process completely the trauma, the sensitivity, the anxiety, the depression, or whatever resulted from a previous experience. But the other thing is that, even things like yoga and other alternative subcultures, sometimes it's a way of trying to find some space externally that makes one feel better. It's almost like a kind of self-soothing thing because especially after this trauma, they don't feel really fully comfortable within themselves, and so they try to assuage that feeling by um, changing their environment when actually the problem is still deep within themselves. But maybe sometimes these other subcultures or experiences will be a bit of a distraction, possibly. So again, these people are easily overwhelmed because their nervous system is not free from this old trauma experience, this old traumatic energy, and so the nervous system is still fried and frazzled because it hasn't had a chance to rest. It's still like it's like on this like loop of trying maybe to release this knot, but it's unable to. So it's just kind of whirling and circling, and that can be draining um, rather than being free and clear of it. And people might even have kind of an unsteady walk or talk or gaze. They may seem a bit off or distracted or distant or checked out. Because again, it's almost like they're instead of being fully in integrity where their mind, their heart, their spirit, their bodies all lined up together and fully aligned, ready to go forward in whatever direction they choose, it's like their heart's over here, their mind's over here. They're just discombobulated. And they don't have, all four horses moving in the same direction. So they sort of end up losing focus, concentration, within themselves, but also like their energy is just scattered because their energy system is still um, dispersed because of this trauma, and it's not sort of reconfigured itself. Um, and again, they may say this, or other people around them may say this, is that after this trauma, they were never really themselves again. And sometimes, never being yourself is a good thing. If you're actively trying to grow and develop yourself and you're like, oh, I really don't want to be that kind of person anymore. But this sort of thing, it's like they're not as present as they used to be. They're not as um, engaged as they used to be. There might be a little bit of a glaze over their eyes. They don't really find joy or excitement in things anymore because again they're just not fully there because this it's like their circuits are maybe need reworking or clearing or something like that. Yeah. um so the risk of being stuck in the state is that they're just stuck in general because there's this lack of complete processing, whether you want to consider it emotional or energetic. um and it can show up again in physical ways, but I think on a more deep on a deeper basis it tends to be more emotional or energetic, the deeper cause. So the potential outcome of taking a remedy like this is that somebody becomes more clear and present and confident and joyful and driven. They're more engaged in life and with others. So that's the Star of Bethlehem. And I do like to mention other remedies because, again, as I've always mentioned, these Bach Flower Remedies can be quite effective, but the trick is you got to find the right one and match it to the person or the case. Because if you're just, I don't know, willy-nilly choosing remedies and stuff, you may not get an improvement. But if you go deeper into the remedy and you go deeper into the person and then you match things up on a deeper level and really match up the subtleties of the remedy and the person, then that's where you can really get some impressive results. So other remedies that might at first appearance seem the same, but, again, when we talk about them a little bit more deeply, you'll see that there's differences. So there's other ingredients in Rescue Remedy that might also initially seem like a Star Bethlehem case or a presentation. So one is cherry plum, and cherry plum is about resisting a healing crisis. And so what happens is when the body or the mind or the heart is in the process of healing itself, and then there's usually this sort of like almost like a rumbling, like a volcano, like whatever that old stuff is about to go or blow through the system. People start to freak out about that. They get nervous about that, and they kind of feel like they're going to lose it. And then what they end up doing is suppressing that feeling, which is actually suppressing the healing. And then they get stuck in that and they don't actually end up healing because it's like the healing process is too uncomfortable for them to bear. And so they subdue it. So because of that, they're kind of held back. So that's a different thing. They're actively, whether they realize it or not, or actively avoiding true healing or full healing because the process of healing is too uncomfortable. So that's different than the Star of Bethlehem. The Star of Bethlehem is just almost sort of like numbed out, checked out. Um, they seem very airy, spacey. Like these are the sorts of words and feelings you get around something like this. So another ingredient in rescue remedy that might sort of seem similar is clematis. Clematis, I've talked about a few times. I don't have a video on this. Oh, anywhere you see a double asterisk here, that means I actually have a video on it. So I think we've got through most of the remedies now. So, but anyway, clematis I haven't done a video on yet. But the clematis is also about checking out, but for a different reason. So clematis people, I tend to think of like artists or scientists who just get lost in the world of ideas and the reason why they check out is because they actually prefer the world of ideas. Like they're happy to just go sit and read a book or hang out with their artwork or whatever all day. Um, and so they seem checked out, but they're okay in their own little world. It's just kind of getting them back to mainstream reality, or more grounded reality that can sometimes be a challenge. But it's not because of any trauma that they've typically become a clematis person. So, other remedies that are related to inactivity, which again on the surface may all seem the same. So, there's sweet chestnut. Sweet chestnut is about getting stuck in the spiritual ascension process. So, that's like a spiritual healing or growth development, which can also be called a dark night of the soul. And in that case, there's not necessarily a trauma. Again, a lot of these you'll know it's not Star of Bethlehem because there's no trauma involved. And sometimes it's hard to identify the trauma, but if there's no trauma, these other things might be appropriate. So the sweet chestnut, again, they're stuck in a spiritual ascension process. They usually are very spiritual people, and they've been living a spiritual life as best they can, and then at some point they just feel disconnected from spirit, and so they feel a bit lost, even though they sort of continue on with their spiritual process and lifestyle. But they sort of get confused about why is it that I'm living this spiritual life, or so I thought, but I don't actually feel like a spiritual connection anymore, which they typically once did. So that's sweet chestnut. White chestnut is a different kind of inactivity. White chestnut is all about being in the head and living in the head and just thinking and thinking and thinking and thinking so much that you just get, the analysis paralysis. So again, this may not be like trauma based. And again, with white chestnut, rather than there being inactivity, there's actually excessive activity, especially in the mind. Then there's larch. Larch might be a remedy that you might consider because larch people are not active. Well, they might be active in a certain way, but they may not be active in terms of moving themselves forward in life. And the reason why is because they feel inferior to others. And so it's even if they at some time or some level thought about moving ahead, they wouldn't go for it because they don't feel like they're as capable of others. So they hold themselves back. So it's again a different kind of inactivity than Star of Bethlehem. Then there's wild rose. Wild rose people, are pretty, in some ways, kind of far gone because they've just become so hopeless that they're not even, if somebody suggests trying something new, to deal with whatever it is that they're dealing with, they won't even try it because they're just like, yeah, what's the point? They're at that point, and so they seem hopeless and apathetic. Then I have talked about remedies: elm, hornbeam, um, oak, and olive. And these are for exhaustion and overwhelm, but again, for different reasons. So elm people have identified too much with their role, like maybe, too much as like a whatever physician or nurse or cop or something, like a somebody who people tend to lean on, kind of a responsible role. And they get over identified with that to the point where they exhaust themselves because they're not really listening. Um, they're so focused on being whoever, kind of living up to the image of this role that they don't really listen to their own personal body signals of telling them, you need to slow down, get some rest, get some balance. Hornbeat people are exhausted and overwhelmed and again inactive and burnt out essentially because there's too much mental effort going on. So like these are students or other people who like use their minds for work who just maybe like accountants or something during tax season where they just use their mind so much that they just get kind of heavy in the head, if that makes sense. Then there's oak people. Oak people are also exhausted and overwhelmed. They probably less so than these others because oak people just tend to kind of try to power through things just for the sake sometimes of sticking to things or just for reaching the goal, even if maybe truly they're not really interested in the goal anymore. They're just like, no, it's all about finishing, reaching the goal. So that can be an oak person. And then olive people are people who have just overworked long term. They've burnt themselves out that way. And so they just have nothing left to give. And they're inactive for that reason. So those are other remedies to consider if we're thinking about inactivity, um, besides Star Bethlehem. So again, Star Bethlehem, you always want to try to assess if there's any sort of trauma. And then if people just sort of shut down after that trauma. So that's it for today. Thank you as always for your time. I appreciate all your support. All the new subscribers, welcome. All the people who send comments and kind words of support. I appreciate that for sure. People who are generous about sending in donations, that's also appreciated. Um, so thank you for all of it. I also have another YouTube channel called Light Vedic Astrology, if that's of interest to you. And I do have an online photography gallery and gift shop where my photography is kind of highlighted. So fun things like, definitely wall prints and things like that, but also fun things like jigsaw puzzles. So, that's kind of cool to have my photography and stuff, be developed into sort of unique and cool creative gifts for yourself or others. So you might check that out if you're a photography buff. So, as always, I hope you found this useful and interesting. And until the next one, take care.